Welcome back to Showcase Pittsburgh on KDKA TV. I'm John Klein. Today, 7 tri-state businesses. Right now, Dr. Ryan Rupert from Robinson Township Smiles is on the show. Welcome to Showcase Pittsburgh, Dr. Rupert.
Thank you very much.
Robinson Township Smiles in Robinson. Where are you guys?
Correct. Our office is located at 66 Forest Grove Road in Robinson Township. We're easily reached off of I-79, Route 60 in the Parkway West.
Let's get a little background on Dr. Ryan. You're kind of a local guy. You said you grew up in Clarion. How did you end up being a dentist? Where did you go to school? And give us your background.
Okay. Well, I grew up in Clarion, PA. I actually had a lot of dental issues when I was a child. I had a bit of a candy habit. My town didn't have fluoride in the water when I was growing up, and I was born missing 10 teeth. So as a result of that, I had to see the dentist a lot when I was a kid. I also went through braces twice. So I decided to go to college for pre-med, went to Washington Jefferson College, and when I was in college I was going through the dental implant process with Dr. Jim Rakowski in Clarion, PA. I was through that process one time at an appointment that he suggested to me that I think about becoming a dentist. I'd never really thought about that before, so at that point I gave it some thought. I saw how passionate he was about dentistry and how he connected with his patients. And at that point, I sort of decided that this would be good for me. You know, with all I'd gone through, you know, I decided I could have some empathy with my patients and, you know, have a real connection because I've gone through what they've gone through.
I would assume that growing up, the dentist probably wasn't your best friend because you went quite a bit. So, as you just said, you can relate to a lot of people who aren't big fans of going to the dentist.
Yeah, absolutely. I mean, almost everything my patients have gone through, I've gone through. You know, I've had oral surgeries with the implants, fillings, a few crowns, braces, you know, so I've seen it, I've had it, you know, so, you know, I know what they're going through.
And braces twice? You are a
braces
lucky kid.
Twice. Oh yeah, oh yeah. Wasn't too happy the second time.
The norm is to go to the dentist every 6 months, but I'm guessing a lot of us don't do that. Is there a big difference in oral health and hygiene if you go once a year or once every couple of years as opposed to every 6 months?
It can make a very big difference. We often see people, you know, say I don't have dental problems, so they don't go to the dentist. One thing we notice, even if you're not prone to getting cavities, is you can get tartar or calculus buildup, which leads to gum disease or periodontal disease. That tartar or calculus is when the plaque on your teeth that you can remove by brushing and flossing your teeth at home, it's when it calcifies and hardens. That happens because in hard to reach areas, it stays put for long enough that it hardens and you can't get that off at home anymore. Another thing we see is people skipping dental appointments because they say things don't hurt or they don't have insurance anymore. Well, when people skip dental appointments because they don't have insurance, we oftentimes see that they actually end up costing themselves more in the long run. Instead of finding cavities when they're small and would just need a little bit filling in them, they then need more expensive treatments like root canals, crowns, even extractions and implants because they let that filling or that cavity get to such a large size. So by being preventive, you know, you can eliminate a lot of those problems.
So there's no excuse for not going every 6 months.
There's not a real good
You're going to pay
now.
more in the long run, and
Yes.
it's going to be a lot bigger process in the long run.
Yes.
You had mentioned a membership plan. And does this involve insurance? How does that work?
My office has a program called Quality Dental Plan, or QDP. What it is it's an in-office membership plan. We offer it to patients that don't have insurance. It's a nice way for them to get some coverage that they don't have otherwise. What it is for a set yearly fee, you get your cleanings, exams, and x-rays for free, and then you get a set percentage off of your treatment. It really works for patients because it allows them to, you know, afford the treatment a little bit better, and you know, it sort of gives them a reason to come in and not skip their appointments.
So this is something that is specifically towards your practice?
Yes, there are other offices throughout the country that offer these programs, but you know, certainly not every office has this.
Do most people have dental insurance, or is it something that that's becoming a thing of the past?
That's tough to say. I feel like maybe about half do.
Okay.
You know, with work, you know, we see work cutting down on benefits and things like that. So I do think coverage is getting worse and worse.
Because it's always a supplement, and you're always like, do I want?
Yeah.
And then you find out a lot of times it doesn't cover a lot of things anyhow.
Yes.
When should somebody have a second opinion? If somebody does see their primary dentist and something is suggested that might be a lot bigger than what you're comfortable with. Should you go for a second opinion to a second dentist?
Yeah, second opinions, they're a tricky thing in dentistry, but there's certainly a time and a place for them. I think the time and place for them are when, if you've seen a new dentist, say you move to a new area and you're seeing a new dentist, but you had been regular in the past with your appointments, and a new dentist recommends a lot of work, well, it might be good to go see, get a second opinion at that point. Or
because you're not 100% sure of
yeah,
what is needed and what might not be needed.
Yeah, it's tough as a patient to know. It's like me taking my car to the shop. I don't know how that stuff works,
Right.
So you don't know.
Right. If somebody comes at you and says you need $3,000 worth of work, you might want to go somewhere else to have it checked.
Yeah, and the first dentist might not be wrong, and I like to stress to patients, don't be afraid to return to that first dentist, because they might not be so bad after all, either.
But in your mind, you're probably thinking, oh, he's going to find out I went somewhere else and there's going to be a problem.
That's what we see, yeah.
So once again, Robinson Township Smiles, you guys have been in business for how long out there?
About 2 years.
Okay. And you see a lot of patients from all over the greater Pittsburgh area. It doesn't have to just be Robinson Township.
No, absolutely not. Yeah, we like to see people from anywhere.
And every 6 months, is there anything that somebody should do behind the scenes before they go to the dentist? Whether it's one of the vibrating toothbrushes or the water jet thing. Is that something that helps a lot?
Yeah, absolutely. I think a mechanical toothbrush works really great. I think one of the biggest benefits of them is that they have timers on them. So people brush for 2 minutes when they use those. You don't realize how long 2 minutes is.
And that's one of those things. When I use it, I'm like, man, I've been standing here forever.
Yeah,
Okay. All right. Well, Doc, it was a pleasure meeting you. If you'd like to know more about Dr. Rupert or Robinson Township Smiles, 412-859-3833 or log on to RobinsonTownshipSmiles.com. Coming up next, Daryl Warden from the Miles Group. That's next on Showcase Pittsburgh.